Hello everyone, welcome to South First. I am Chetna Belgire. A recent Health of Nation 2024 report by Apollo Hospitals called India the cancer capital of the world. To speak about where we are going wrong and how can we prevent this, we have with us Dr. Narayana Subramaniam, Senior Consultant and Director, Head and Neck Surgery and Director of Clinical Innovation at Spurs Hospitals. We welcome you, sir. So first of all, do you agree with the report that India is the cancer capital of the world?
So I think yes and no. There are a couple of parts to it. So when we look at absolute numbers, the numbers are alarming. And if we look at epidemiological trends, which means the increase in the rate at which we detect these cancers, those are also going up. So when you look at the Indian population, obviously we are a very populous nation. We have a lot of people, and therefore the number of patients that we have with cancer is expected to be high. But there are a few components to this thing. So one is it's important not to panic. So one interpretation is that especially with certain cancers, we have gotten better at diagnosing them. So very often patients used to have these cancers, die from these cancers, and we never used to diagnose them.
Okay.
But we've gotten better at detection. But also there is increasing trends. And the reason for that may be an increase in the number of risk factors that patients have to develop these cancers.
Okay. So let's go one by one. So first of all, I would want to know which are some of the cancers which you're referring to that has actually, we are better at diagnosis of these now. Also, which are some of the cancers which are a cause of concern now, where you are actually seeing the rise in numbers?
So I think the list may be overlapping to some extent. So the increase in the numbers for particular cancers. So there's definitely an increase in the incidence of breast cancer amongst women. There's an increase in head and neck cancer, specifically oral cancer. There's an increase in thyroid cancer. All of these are increasing. There are also some increasing trends with respect to gastrointestinal cancers like colorectal cancer, especially in the young, and of course, lung cancer. So lung cancer is a very important consideration. When we look at early detection, the point is very often some of these cancers, like thyroid and breast cancer, are picked up when we scan for other things. So very often you have chest pain, you may have a scan of your chest, you may pick up an incidental breast lump. Similarly, you have some pain in your neck, somebody's looking at your cervical spine, we pick up a lot of these thyroid cancers.
So when you look at the percentage of voluntary diagnosis versus, by chance discovery of cancer, what is the percentage like, sir?
So it's a little hard to generalize, to be honest, because there's so many different types of cancers. And the answer to your question varies very much in the context of where you are and other things like your socioeconomic status. For example, you work in a multinational corporation, you need to have annual health checks in order to renew your health insurance is going to be very different than somebody who lives in a tier 3 city, an agricultural worker who goes to a doctor, once in 5 years, who has never seen the inside of a hospital. But I think the thing that we have to focus on here is that we have to understand that early detection is very important. And when we talk about screening, we have to screen for particular cancers. So there are some cancers that we are recommending not to screen for, simply because when we pick up incidental cancers that are low grade and may not need treatment, we don't want to overtreat. But thyroid cancers, for example, are not cancers that we screen for because the vast majority of them are very well behaved, so to speak. They don't cut short the life of an individual, so we don't go looking for them. We are okay to wait till they become clinically apparent. And even when we treat them at that point, it's not going to impact the survival of a patient. Similarly, screening for prostate cancers in some populations may not make sense. Similarly, doing mammograms in some populations may not make sense. But I think in India, I would always be a little more cautious about recommending those things because the health seeking pattern is very different. Who pays for the treatment is very different. Now, if you live in the UK, for example, the NHS pays for your annual mammograms, and those recommendations are based on the cost benefit ratio. So the NHS is paying for either your detection of your cancer or your final treatment for cancer. Whereas if you live in India, if you're uninsured, you're paying completely for your treatment costs. So the difference in cost and the difference in survival between a stage 1 cancer and a stage 4 cancer is vastly different.
Absolutely.
So I think the message I would like to get out in the Indian context is to be more aware, more proactive with respect to your health, and get early detection, get screening definitely for certain types of cancers, but be aware of different types of cancers and be proactive in seeking health treatment related options for all of these things.
So when you're saying that, there are certain cancers which you really have to screen for, talking from an Indian scenario, which are these cancers? If you could list, is there
Yes.
a list which is already there with every, like everybody knows that, okay, these are certain cancers which you have to actually definitely screen for once a year, 6 months once. How does it go? Is there a protocol like that at all?
It's left to the individual. We don't really have clear recommendations or guidelines.
Okay.
But what we would consider is based on the incidence and your particular risk factors, you have to decide when to screen. So screening for breast cancer definitely makes sense in our context, in our population. Screening for oral cancer, if you're a high risk patient, in the sense if you have a history of tobacco and alcohol use, getting screened is valuable. Getting colonoscopies also is valuable after you reach a particular age. So these are a little contentious. If you have a family history of cancer, again, very, very important because some of these can be inherited cancers. So getting screened for cancer and early detection is key. All I can say is be very aware of your body, be aware of the symptoms of cancer, and at the slightest disruption, please get it evaluated by an oncologist or somebody who treats cancer and can diagnose you quickly.
So first thing you said is don't panic with these numbers is what you started your answers with. But I would
Absolutely.
like to know when you do a Google search for any of the symptoms, when you look at
Mhm.
that's the trend now. People are aware in terms of they do want to know about their disease. At least in the urban setup I'm talking about, where they actually go into seek answers through internet, and everything kind of leads to cancer. So is there anything, any kind of a where you look up for these symptoms and say, yes, suppose you have a family history of cancer and then you have certain symptoms, and then you say, yes, I should be aware of this and I should now go and screen. So, is there something which people can actually look for?
So what can say is go to reputed organizations. When you're looking online, go to websites and information from reputed organizations, be it the World Health Organization, be it the Indian Cancer Society. There are several good hospitals as well that put up verified, credible information. Don't do general Googling because it's really not verified information and it may not be applicable to you. And once you do your background information, you have to speak to an oncologist. There's no way around it.
So, coming back to the report, we're talking about numbers going up, right? So, I wanted to understand, are there any particular reasons that you see that the numbers are going up? If you could just break it down to some common reasons which you're seeing that this is the reason why the cancers are going up. Is there anything like that?
Okay. So one thing is detection. Obviously, we're getting better at detecting them. Their patient awareness is also improving. Societal awareness is improving. So one area I can say really that has happened is breast cancer. Where a patient has a breast lump, their mind goes to cancer, which is a great thing because they get it ruled out. It may not be cancer in the majority of patients, but at least women seek out help and they get evaluated. That unfortunately doesn't exist for a bunch of other cancers. People think it's a multitude of other symptoms. So early detection is one thing, whether it's patient directed, where the patient comes in to a doctor or to a hospital and gets it evaluated, and the incidental detection of cancer. So it's cancer is less likely to be missed on a scan. The quality of our scans is a lot better. The resolution of ultrasounds and CTs and MRIs are better. We can pick up very small cancers. We end up doing a lot more PET scans even for patients who don't have cancer. Sometimes it's being used for patients with fever of unknown cause and things like that. You pick up small nodules in the prostate and the thyroid. So that is one thing. The other thing is trying to understand why the actual incidence of cancer is going up. So both of them are two independent features. It's not just that we are picking up more cancers and detecting more cancers, the incidence is going up. So in oral cancer, funnily enough, we're seeing more and more patients who have never touched tobacco or alcohol. So for us as oncologists, there is this interest, and there is a lot of research that's going into these areas. Some of the areas that we are interested in, but to be very clear, we can't attribute it to them yet, right? So these are just what we call associations and not causations. So one thing is whether ultra-processed food, those changes in our diets basically are predisposing us to cancer. The other thing is obesity, right? So there is a lot of interest in the US. There's a lot of data linking increase in thyroid cancer to obesity levels. So in India as well, we are having that same issue. We're having a lot more patients who are overweight and obese. That's clearly linked to breast cancer, colon cancer, host of other cancers, also interest in thyroid cancer as well. There's also concerns about, things like pesticides and environmental factors. So it's highly unlikely that these are not impacting our cancer risk, but we really need to do a lot more research to understand it a little better. For us to say, for example, the way that we say with tobacco, smoking these number of cigarettes over these many number of years increases your risk by this percentage, we are not there. So this is why for research is so important.
Okay.
Very often we think of research as something that's really far off. We think of it as something that doesn't have an impact on our day-to-day practice, but really not the case. Unless we do that research now, 5 and 10 years from now, we won't be better at treating these patients.
Okay. So is it even possible to prevent cancer? You just gave us some of the reasons like obesity and lifestyle and environment and those things. But is it really possible to prevent cancer? Because you have certain infections which you say, okay, we can prevent it by doing these things, by taking these steps. But how about cancer? Is it really possible?
Absolutely, absolutely possible to prevent cancer. So the ones with a strong genetic link, right? The ones with an inherited link are very few, right? The percentage again varies from cancer to cancer, but the vast majority of cancers are sporadic, which means they happen because of some abnormal change in our DNA, some kind of DNA damage that our body is not able to compensate from. They're sporadic, which means that they may be linked to environmental changes, they may be linked to exposures like tobacco and alcohol, but they're not actually linked to a, a, a hereditary cause. So the vast majority of cancers that we see are sporadic, which means there's no strong genetic link. We are not passing down, a genetic mutation or something that causes cancer in the offspring. So for those patients, it's very simple. Number one, cut out tobacco and alcohol, right? So these are the exposures that cause cancer. Very, very clear. There's no safe amount of tobacco or alcohol exposure. So you want to cut your risk of cancer, absolutely stop all of that. Have a balanced diet. By balanced diet, we mean green leafy vegetables, good mix of protein, good mix of fiber, no ultra processed foods, avoid too much red meat in your diet. All of that has been very clearly outlined. Third thing is exercise, right? So exercise is very important. Staving off things like obesity are very, very important. Obesity has a very clear link to multiple cancers. So you don't want to increase your risk of cancer. Control your weight, just get up and move. A lot of movement, reduce your body weight. Fourth thing is vaccination, right? So there are some cancers that are preventable with vaccination. Hepatitis B is linked to hepatocellular carcinoma, which is a lethal form of liver cancer. Luckily, most people are vaccinated for that at birth. It's part of the immunization schedule. We now have a wonderful HPV vaccine. So when you take an HPV vaccine, for girls, it prevents cervical cancer. There's also data that it prevents oropharyngeal cancers. So it's probably valuable to get the HPV vaccine for men as well. So these are just the simple things that you can do. And then also be aware of cancer, early detection. So stage 1 cancer, for most cancers, very, very treatable, very curable. Just get evaluated early. Treatment options are wonderful. Chance of cure is very high.
So is there any like cancer care is expensive? I mean, all said and done, it is still considered to be
Absolutely.
expensive. So is there anything at all, any solution? Because people stop once they get to know that they have cancer, they absolutely don't come forward for treatment because assuming that it's expensive and they don't want to take it forward. Is there any solution to this at all?
Please buy insurance. Absolutely, absolutely. Please buy health insurance. If you are covered through your employer, excellent. If you have good health insurance coverage, wonderful. The state-sponsored health insurance varies from person to person. Some of these limit where you can get treated, what your coverage is, how much you can get treated. So be aware of insurance. So far, we haven't thought about it very much. We have outsourced the responsibility of our health to another third party or a fourth party. So just buy health insurance. Don't think of it as a waste of money. You have insurance for your car, you have insurance for your house, you have insurance for 10 other things. Insure your health. If you do this, treatment becomes affordable. Treatment is unaffordable because you are not meant to pay for these things out of pocket. So if you look at even a simple surgery that we do, it's very sophisticated. We use a lot of equipment. We use a lot of what are called consumables, which we only use once. So we use a lot of equipment that we throw out that is expensive. It's not meant for you to pay out of pocket. So we have to stop thinking that we don't invest in health insurance, and then suddenly when we have a health issue, we have to shell out lakhs and lakhs.
Is there any policy measures that India can actually ape the West in cancer management and prevention in itself? Like other than the screening programs and awareness programs in rural areas, is there anything else that you think that the Indian government can actually ape the West?
So I think screening is very, very important. It's not something that we invest in much as a state or a country. I'm glad that I think the Karnataka government now is going to screen for certain cancers. And the reason is very simple. When an early cancer is detected or pre-cancer is detected, the amount that the government has to pay out, even if the patient is on a state-sponsored insurance scheme, is small. But if you end up paying for the treatment of an advanced cancer, it's massive. So one unfortunate statistic is when you look at all the BRICS nations, for example, India spends more per patient of oral cancer than all the other BRICS nations. And the reason for that is because we are not picking up these patients early. When we pick them up in a stage 3 or a stage 4, they need a major surgery that takes hours and hours. They need hospital stay for 10 days, 2 weeks, and then they need radiation and chemotherapy. So one thing is screening. Nobody will invest in screening other than the government. The second thing is, I think, is strengthening public-private partnerships. The government does put up a lot of infrastructure. The private sector also does have a lot of infrastructure up because India pretty much has a free market policy when it comes to, health institutions. So I think probably opening up these state-sponsored insurance to public players by ensuring, I think, uh, better reimbursement policies and more adoption in the private sector might be very, very helpful because the public sector often does have unutilized beds, unutilized infrastructure, unutilized manpower. The third thing is forcing more people on insurance. So the state-sponsored insurance currently is focused at people at the bottom of the pyramid who cannot afford health insurance. But I think the government also has to play a role on forcing patients who can afford it to take up private health insurance. This has happened in a place like Singapore, imagine, where the government realizes that by paying for everything out of pocket, if the government takes up the responsibility of this entire burden, it's not going to be sustainable. So how that works is for patients at the bottom of the pyramid, the government shells out. For patients who are higher tax bracket, you make private insurance mandatory. We have to stop thinking that we can pay for major surgeries and chemotherapy and radiation out of pocket. A linear accelerator machine that administers radiotherapy anywhere between 28 and 40 crores. So how can we possibly pay for that treatment out of pocket? So we need a mindset change. We need to have better health insurance coverage, more responsibility for our health, and then the system will be unburdened to work a lot better. I think basically what we all have to realize is cancer is here to stay. I wish that we could have a magic bullet that could get rid of everything and then you don't need any treatment. Basically, it's not one disease. It's hundreds of disease, right? So even, in individual organs, there's so many different types of cancer. So there's no reason to panic. We have to accept that we are going to live with this. It's a cost, I think, of some of our environmental exposure, some of our lifestyle changes, and it's the cost of living longer. when we understand this, we are more proactive about our treatment. It is still a very, very curable disease. If you get treated early, and some patients even who get treated late with advanced stage disease go on to live long, fruitful lives. So don't get panicked. Don't give up hope when you hear the word cancer. Those of us who treat this disease on a daily basis, a lot of hope.
Thank you very much, sir. It was wonderful having you on the show as usual. We'll look forward for another one very soon.
Thank you.
Thank you very much.
Wonderful talking to you. Thanks so much. Thank you.